Personal hygiene. The best prevention for an infectious disease such as influenza is good personal hygiene. The influenza virus is primarily transmitted by airborne germs caused by coughing or sneezing. There are 4 personal hygiene measures that you can use to help delay the spread of the influenza virus. The first is washing your hands. You should wash your hands frequently. If your hands are visibly soiled, you should wash your hands with soap and water. Rub your hands together for at least 30 seconds, making sure to clean between each finger. Rinse well. Then dry your hands with your own towel. Use a towel to turn off the tap. Do not use a towel that is used by other associates or family members. Cloth towels should be changed 2 to 3 times per week. If your hands are not visibly dirty, use an alcohol-based cleanser. Wash your hands in the same manner as with soap, but let your hands air dry. Do not use a towel. The second step is to suppress coughing and sneezing. The influenza virus is easily spread through coughing and sneezing. You should cover your mouth and nose with a tissue every time you cough or sneeze. Use cough remedies to help suppress coughing, and a mask if it can be tolerated. If you are sick, you should stay at home. The third step is the use and disposal of tissues. Make sure to have plenty of tissues at hand. Cover your nose and mouth when using a tissue. Use each tissue once, then dispose of the tissue in a dedicated bag. Close this bag with a knot and place in a regular garbage bag. The fourth step is the use of personal protective equipment, such as masks and gloves. These should be worn when you are in crowded places, such as shopping malls, banks, or public buildings. Masks and gloves should also be worn when caring for sick family members. After leaving the room of a sick person, it is best to stand or sit in daylight for approximately 5 minutes, because the influenza virus is very susceptible to UV light. Observance of these measures is an important part in preventing the spread of the influenza virus. For further information, please review the 3 additional videos in this series. You can also receive assistance from your local HSE representative. Using a mask. Before you handle a mask, first wash your hands with soap and dry them thoroughly. The most effective masks carry the labels FFP2, FFP3, HEPA, or N99. When worn correctly, these masks filter approximately 99% of the droplets that carry the virus out of the air. So the mask properly fits to your face, first place 2 fingers in the mask and bend the nose clip around your fingers to form a nose shape. Hold the mask in position over your nose and mouth. Then pull the lower portion of the strap over your head and fit it around your neck. Then stretch and pull the upper strap onto the back of your head, above your ears. Then reform the nose clip around your nose. Test the fit by cupping both hands over the mask and exhale vigorously. If the fit is correct, air should not leak from around the sides of the mask. Children should also wear a mask. The mask is applied to a child in the same manner as an adult. The mask should fit tightly to the child's face. The straps may need to be tied in a knot to assure the mask stays in place. Taking the mask off should be done by an adult to make sure that the mask does not become damaged. Change the mask immediately if breathing becomes difficult, or if it becomes damaged, distorted, becomes wet, or if it does not fit properly to your face. When not in use, store the mask in a warm, dry place and protect it by covering with a cloth or a piece of paper. Observance of these measures is an important part in preventing the spread of the influenza virus. For further information, please review the 3 additional videos in this series. You can also receive assistance from your local HSE representative. Social distancing. Social distancing is keeping a proper distance from other people in all situations. Social distancing helps to curb the spread of highly contagious diseases such as the influenza virus. In order to help ensure your health, as well as a healthy workplace in the event of a pandemic flu, the following steps should be followed when you are in an area with other people. Make sure you keep a distance of at least 1 meter from other people. Do not under any circumstances shake hands or embrace anyone. This includes in meetings, in the office, in public areas, and at home. Reduce the number of person-to-person contacts you have by not attending public gatherings, visiting family members, or accepting visitors. By keeping your distance from other people, you will protect yourself as well as reduce the spread of any virus. If you become sick, you should avoid all contact with other people. Observance of these measures is an important part in preventing the spread of the influenza virus. For further information, please review the 3 additional videos in this series. You can also receive assistance from your local HSE representative. Cleaning surfaces. Keeping all hard surfaces clean, such as tables, countertops, floors and instruments, will help curb the spread of highly contagious diseases, such as influenza viruses. These hard surfaces should be cleaned frequently using commercially available cleaning agents and water. Cleaning agents that are effective in killing influenza viruses are soap and disinfectants such as diluted chlorine bleach or 70% ethyl alcohol. Make sure to use gloves, cloths and mops when applying the cleaning agents. If you are caring for a person who is sick with an infectious disease, you should take precautions so that contaminants are not spread outside of the house. You should frequently wash your hands with soap and immediately clean any surfaces that a person contaminates through coughing or sneezing. In the home, clean all of the hard surfaces in the baths and bedrooms daily. All other areas can be cleaned 2 to 3 times per week. Observance of these measures is an important part in preventing the spread of the influenza virus. For further information, please review the 3 additional videos in this series. You can also receive assistance from your local HSE representative.